you are able to hear me. So today I am going to talk about the care of plaster. So in case of fracture, we put a plaster if the fracture is minimally displaced or undisplaced, or sometimes if it is displaced and it came to its place after reduction, and it is when it is stable, we apply plaster. So plaster also, there are two types of plaster. One is a uh, plaster of Paris cast, in which is a white, and it is a heavy one. But the advantage of it is it can be molded as per the requirement of the immobilization. And second one is a fiberglass cast. That is a synthetic one. Advantage of this fiberglass is it is lightweight and hard. But disadvantage is molding of the plaster is difficult in fiberglass. So initially when we are applying plaster, for initial days we apply with the POP, plaster of Paris, and once the fracture is in place, and after some days when uh, we are telling the patient ki you can put a weight on the leg, that time we change to fiberglass. So especially in the lower limb like leg, ankle, so in that case we can put a plaster of fiberglass, and on that patient can walk with support, because the fiberglass is a very strong. So patient will be having that advantage of walking early with the fiberglass, and that is a lightweight also. So what care we have to take at home with the plaster, either it is a POP or fiberglass. First and foremost is limb elevation. Always keep your limb elevated, especially lower limb. When you are sitting, put one table or chair in front of you and elevate the limb. Second, while sleeping also you can put a pillow and you can elevate the limb. So the advantage of elevating the limb is the swelling goes on decreasing, and as swelling decreases, the stiffness will get, uh, you can move the toes or fingers easily. So, so first and foremost is limb elevation. Second is movements of the toes or fingers. So as you keep on moving the fingers, toes, because of that the swelling reduces, stiffness decreases, and third most important is do not wet the plaster. If you wet the plaster, what happens? Because of that the plaster gets damaged, and once the water goes inside the plaster, your skin gets macerated. So in that case we have to remove the plaster. So to avoid that, don't wet the plaster. And some patients, after especially after 8 or 10 days of the application, they'll get itching sensation, discomfort. So even if you are having discomfort or itching, don't put anything inside the plaster, okay? Because once you put something in that, that itchiness will increase. It will goes on. Uh, it will increase. So So better initially only don't put it, because if you're putting some pencil, some pen, that will damage the skin. So because of the damage, the itchiness will increase. And if some foreign body goes inside also, that will cause a discomfort to the patient. So these are uh, basic care you have to take at a home. And again, one more thing is regular visit to the doctor. Initially, when you apply plaster, after 24 hour or 48 hour, you visit to the doctor again. Okay, so that is for to check whether it is in good condition or not. Doctor will check it. Okay, and third thing is most of the plaster we keep for 6 weeks, because the bone healing takes at least 6 weeks to start it properly. Okay, the hard callus starts forming at 6 weeks. So most of the plaster we keep for 6 weeks. So there are exceptions like the plaster above the elbow joint. When you are putting a plaster above the elbow, that time if you immobilize your hand for 6 weeks, that will cause a stiffness of the elbow joint. So for that, normally we avoid putting plaster for 6 weeks. In that case, we put for 4 weeks. Same thing is above the knee. So plaster which are extending above the knee up to the ankle or toes, that we keep only for 4 weeks, because again the knee joint is very notorious for stiffness. So that's why we keep the plaster for above knee. Above knee plaster we keep for only 4 weeks. So these are basic precautions. So one more request for you guys is this is my second live only, so please subscribe to the channel, so it will encourage me to do videos and live queries. So, and any topic you want to ask regarding, just mention in the comments. We will talk about that topics. So I think we will end our live session here only. Any comments? Okay, no questions from you guys, I think. So we will end here. Thank you. Bye bye.